Hi, I'm Dr. Robin Berzin and I'm the founder of Parsley Health. Today we're talking about the thyroid and how to know if you might have a problem with your thyroid. The thyroid is a gland in your neck. It's right here and it's important for your metabolism. The thyroid produces a hormone that talks to every single cell in your body, and it's very important for regulating a lot of the processes that your body does every single day. The shocking news is that something like 20 million Americans have a problem with their thyroid, and 1 in 8 women will develop some sort of thyroid disease in their lifetime. So, how do you know if you have a problem with your thyroid? Well, the most common issue people have is hypothyroid or low thyroid, and the symptoms of this are pretty clear. You might suffer from unexplained weight gain, constipation, dry skin, aches and pains, food sensitivities, brain fog, or depression. Now, there's certainly other symptoms of hypothyroid, but those are the main ones to look for. If you suffer from more than 3 of those, I would definitely go see your doctor and get tested. Now, the most important thing about testing for thyroid issues is that you want to test for them the right way. Most doctors only test TSH, or thyroid stimulating hormone, which is the hormone from your brain that tells your thyroid to turn on. And they wait for that to be high to show that your thyroid isn't listening. Now, I'm a functional medicine doctor, and in functional medicine, we don't wait until disease is progressed and to test you. We look at how your body is functioning today. So we look a little bit deeper, and we look at a few other biomarkers, a few other blood tests to tell us how your thyroid is doing. So I always look at not only TSH, but free T3 and free T4, sometimes reverse T3, and to see whether you have antibodies to your thyroid, which is an autoimmune condition where your thyroid is under attack. And I look at those standardly on nearly every patient because I want to know and predict, are they going to have a thyroid problem even if they don't already? Now, there's some natural things you can do to support your thyroid, and it's not all about taking medications. The number one thing you can do is to stop eating foods you're sensitive to. Things like gluten and dairy that people are eating all the time and don't realize they're sensitive to could be causing a thyroid problem over time. Another thing that's important is making sure that you're not low on essential nutrients, and this is so common in my practice. I test people for these nutrients every single time they come to see me, and I make sure that they're not low on zinc, selenium, vitamin D, magnesium. These are all very important nutrients for your body to operate on a day-to-day basis, and especially for your thyroid to work well. So if you think you might have a thyroid problem, first thing to do, go see your doctor, ideally a functional medicine doctor like here at Parsley Health, but just make sure that you get tested. It's really hard to know if there's really a problem with your thyroid unless you get a blood test. It's an incredibly common problem, and we write a lot and talk about thyroid health here at Parsley Health. If you want to learn more, it's parsleyhealth.com. Thanks.